Testing. All right, welcome everyone to our Newfound Education Series, Part 1. Woo! This will be a 5-part series. All right. So these are the dates of our next ones. I'll have a copy of that or posted in your email.
Lots. Oh, ouch, ouch.
On what used to be called Vibrant, aka the wall.
The wall, it'll be on digital signage, lots of places. Ask anybody on the panel here. We'll tell you.
Reminders. So through this series, we're going to be talking all about Newfound, but session 1 is primarily what to know about Newfound. Finance will be presenting in session 2. Session 3 will be meet the team of Newfound. Session 4 is life engagement and memory programming. And session 5 is going to be a resident and family panel. That'll be residents that have stayed in Newfound, either that have moved there or have gone for respite, and also family members that have helped their loved ones make that transition. So specifically, our agenda today, we'll start with the beginning. How do you move to Newfound? How we kind of prioritize the wants, the needs, and the emergent needs of coming to Newfound. The steps of prioritizations, and then also how we can help support you in independent living. Today's speakers. Do you want me to do it? Everyone will introduce themselves.
All right, I'm Caitlin Knapp, wellness nurse practitioner. Mostly everyone here. Thank you.
Now I feel like this becomes a competition. I know. I'm Jen Merriam, Director of Social Services.
I'm Molly White, the social worker in Newfound.
Yeah.
And I'm Lauren Lennon. I'm the Assistant Director of Health Services.
So Samantha Lagasse is also the Director of Health Services. She's tied up right now, but she might be hopefully joining us at some point. All right. So respite at Newfound. Transitions of Newfound Lodge can occur for lots of different reasons. So they could be temporary for an acute changing condition, which really that means you have a surgery or an unexpected illness or a fall or a break. And something's happened where your condition has changed and you need more help. So we can transition to Newfound, and that would hopefully be temporary. So illnesses and surgeries can kind of be planned or unplanned. So say you fall and you break something, you might have surgery afterwards, or you're just planning to upgrade your hips, knees, shoulders. Upgrade. Yeah. So any of those, we can also help you in your recovery afterwards. What is needed is a provider's order. So we need a medical provider to say that it's medically necessary for you to come over. And that's a pretty easy thing. So we'll reach out to your primary care doctor. Caitlin might start in that process as well. If you have a planned surgery, it's your orthopedist. But really, we need that. You can't just walk over in the morning and say, I think I'll stay. So it is a little bit of a planned process, although it can happen quickly depending on your needs. So a transition always involves the resident and the designated family or durable power of attorney for healthcare in a decision-making process. So, we want your buy-in on this. Hey, Sam. We already introduced you.
Awesome.
All right. So then moving to Newfound. So, if you move there on a permanent basis, that can happen for lots of different reasons too. Maybe you need a higher level of care, um, and that's been discussed with you or your loved ones. You've had a change in physical condition, you need more physical support, or maybe you need a different level, your cognition level has changed, and you need more support getting to the activities of daily living, getting to the activities that you want to participate in, make sure you're getting to meals. And once again, these transitions are always going to include you, and if you want us to, include a family member or a durable power of attorney for healthcare in making your decision. So no one is dragged over in the middle of the night. It's a conversation. And many of these conversations, especially if it's a permanent move, these are recurring conversations that we're having over the course of weeks, months, and sometimes years. So a lot of that, we'll talk more about that today, of how we know where you might move, what's the most appropriate, and also if you don't want to move, some of the supports that we can get you in your independent living apartment.
I'm going to stand over here if that's okay. Only because I need to see this. All right, so hi everyone. Again, I'm Jen Merriam, Director of Social Services. So we talked about the different ways that it can happen, but what we're really going to look at when you or your loved one come to myself or Caitlin usually, or maybe anybody that's on this panel, and you're like, I think we want to move, or I want my loved one to move. We'll leave that example out there. We talk about wants and needs and emergent needs. So you're coming in, you're like, well, I think I want my loved one to move. We're going to look at these different things. We're going to say, is this a want? Kind of, and then we talk about those things. Is it a need because it's after a planned surgery, or there's safety concerns? Maybe you've got caregiver burnout. And then also too, we'll talk about those emergent needs. Kind of suddenly you're coming back and suddenly you need some extra help. So whether that's you having the hospitalization, your caregiver having an emergency, we're gonna address that. So all of these are valid reasons on why you might go to Newfound for a permanent or a temporary stay. These are mostly temporary stays. So just to go through each of these, caregiver respite. So you're a caregiver for your loved one and you just need a break. It's been so long since you got a full night's sleep. It's so long, that you've been able to kind of manage their medications. So maybe that leads into maybe you're going on a vacation or you're going to someone's wedding or graduation, and you need someone to take care of your loved one while you do those things. So those would be a couple of reasons why you want that support. Again, it's temporary. The next part to that too is symptom management. So maybe you hurt your back and you can't dress yourself. You go out to the hospital, they say maybe you have a fractured bone somewhere. So it's nothing that's permanent. You'll get better from that is the anticipation, but you need some help with those activities of daily getting dressed. You need help managing your medications. You might not be able to cook as much as you do or eat in your own apartment. So kind of all of those are reasons that maybe you want to have that care. The needs. So again, as Molly mentioned, kind of those planned surgeries. That's something like talk to social services, talk to Caitlin. We'll get you kind of on the list to make sure that we're following you. So when you have a planned surgery, Molly is following you out at the hospital. So she's in touch with the case managers, the care managers there, social workers depending on the hospital. So if we can start to plan your return, so maybe you do come back for respite or maybe you go back to your IL apartment, but in both of those situations, kind of we're hearing from the hospital to hear kind of what their thoughts are on that too. Ultimately, it is your decision, but we just want you to know too that we're following you along too. So it's no surprise like, hey, I'm being discharged today at 10, what's gonna happen with me? So we do have those conversations with the hospital, and we'll also involve you in it too. Like, hey, are you thinking you wanna come back for respite? So we do those sorts of things too. Safety concerns. Maybe something has happened, or maybe it's a progression in a disease that maybe you can no longer manage your own medications. Maybe you can no longer make sure you're eating. You kind of don't have, maybe you've lost the recognition of when you're hungry that you should eat. So that might be another reason that you come over to, you go to Newfound. And again, that care partner and caregivers wants and needs, kind of that's playing into that too. Caregivers are great until maybe there's something that happens. Maybe there's an activity of daily living that you choose not to do for your partner. I mean, I'd say to my husband, I hope I never have to wipe your butt. Like that's where my line is drawn right now. But maybe, you know, in 10 or 20 years, maybe that'll change. But right now, kind of that's it. So it's really kind of between you and your loved one, what you're comfortable doing and for how long you're comfortable doing that. We all have our own ideas on that. I know there's some people in here that have been caregivers for their spouses. You may have had a completely different idea or experience of what that was like. So those are all very situational and person-centered. And it's how long you've been doing it too. You know, maybe you've been a caregiver for 15 years and you're like, you know what, my back can't take it anymore. I need some help. So that might be another reason that there's a need for that, for a move to Newfound. And then there's the emergent needs, as Molly talked about too, the post-hospitalization. Maybe you as the caregiver have some kind of emergency. You went out at the hospital. We've seen that. So who's caring for your loved one? Give a call. We help put that in place. It's going to involve a lot of Caitlin's time to kind of help get those emergent orders in place. We work closely with your primary care provider to get information from them as well. So kind of it's all kind of depending on the timing on these things, how quickly they can happen. But we do have that ability to get those needs met. And then part of that is how we prioritize people. So let's say 3 different people come to us and there's only 1 bed. We're going to look at these sorts of things here. We're going to look at the IL supports. Are there things we can do to keep you in your apartment? Maybe that's working with a home health program, which I know Caitlin's going to talk about. Also, can the wellness clinic, they're here Monday through Friday, 8 to 4 for now. Monday through Friday, 8 to 4. So what could happen in that time? Is there some management that could happen? Could you come down and get your blood pressures checked every day? But beyond what Riverwoods can do, what can your neighbors and your support network do for you? I know you've all made friends here, so maybe you'll feel uncomfortable calling somebody, but also to know that everybody wants to help everybody else. So if you've got a neighbor and you're out at the hospital and it's 11 o'clock at night and you know this person is a night owl and drives at night, maybe you give them a call to bring you back home from the hospital or things like that. So this isn't just Riverwoods. It's your community and what you build for each other. Talking with social services or wellness ahead of time, kind of maybe there's some resources, maybe, again, to stay in your independent living apartment, you need some help in the morning and at night. 7 days a week, we could talk about private duty agencies that are out there to have you come in and do that. But then also, too, we're going to look at how can we best meet your needs in the most appropriate setting. So like I said, if there's 3 people and there's only 1 suite available, we might talk about what could happen in your apartment, but also, too, we'd look out to our sister communities, Exeter and Manchester, and see if they have the appropriate bed for you, and then have you come back to Newfound as soon as a bed becomes available. We talk a lot about that, but also, too, just to let everybody know, we've had somebody from Manchester come here because they were out of respite bed, so it does kind of go both ways. So we're here for you, kind of if you've got questions, kind of talk to social services, talk to the wellness clinic, and we'll kind of go from there. But we're here for you. We get you and we got you. So come talk to us and we'll figure out which way to go.
Right. Everyone can hear me okay? All right. Very good. Thank you, Jen. Jen spoke a lot to the wellness clinic, but as you know, we are there in the wellness clinic 8 to 4 Monday through Friday. We have our specific walk-in hours. That's when when I am guaranteed, or a nurse is guaranteed to be there. Outside of those walk-in hours, most likely somebody is always there. But we might be at a home health visit or we might be at a meeting. So it's possible that outside of the walk-in hours, you might come and it might be closed. that's kind of really why we specify those particular hours. You can also call and schedule an appointment, as most of you know, to guarantee there's a certain time that you come there. But in regards to Newfound and thinking about a transition of moving out of your independent living to Newfound Lodge, our main goal is to keep you healthy and so when we start to get concerned about your health and your safety in independent living is when we really start to have the conversations around, is it appropriate for you to still live in independent living? Is it safe for you? Are you okay to live in independent living? And so then we start to look at what we have for support. You might just need to come down for walk-in hours once a day and the nurses during the week, and that's enough to keep you healthy. But you might also benefit from having us come to your apartment and help you with some activities of daily living, managing medications, those types of. And so we have our home health program. Again, the home health program is also limited by our hours of operation, so 8 to 4, Monday through Friday. But we are a state regulated program, so we admit you to our program, and then we can provide medical services inside the independent living department. And that can look very different to all the different scenarios of health needs. So there's been a lot of different scenarios discussed, but for example, if someone had a shoulder replacement and needed help showering because they aren't able to shampoo their own hair, but otherwise they're safe and they're able to stay in their independent apartment, that is something that we could go in and help them during our hours, of course. And then, there's a lot of different scenarios, but even just having some conversations. One of the main things that we do through the home health program is help people manage their medications. And sometimes that's really their number one safety and health issue. It can be really confusing when you start to get on one or more medications. They're different times of day, and the labels are very small, and they all look the same, right? And then, you get a pill that's white one week and it's blue the next. There's a lot of things that can be confusing and go wrong when it comes to medication. So that's something that we can help you with through the home health program. And sometimes that's enough to keep you safe and healthy in your independent environment. So
And that's usually one of the first things that happens, right? Kind of managing medications is maybe.
yeah, typically, and even having conversations because sometimes people are taking medications in the morning or night. But maybe they only need it once a day, and we can remind them to do so. And that's really all they need to stay safe. So there's a lot of different things that we can do through the home health program. Medication management seems one of the most prominent, and I think one of the most effective ways of making sure people remain healthy. But other things that we can do include companionship, so spending a couple hours with somebody each day, and that could give their caregiver some relief to go run errands or do something during that time frame. We also talk about other services within the home, like light housekeeping, um, helping someone start their laundry. Sometimes things like that can become a little bit difficult, but have a huge impact, and it's easy for us to support them and that can be enough to keep you in your independent living apartment a little bit longer. If it is something where you have a health need that extends beyond our hours and our support, we are going to talk about, of course, a transition to Newfound and what that would look like. But if you wanted to remain in independent living, we could then talk about other resources. So you might come in for walk-in hours and be on the home health program, but also want to hire private duty nurses to come in when we aren't available. Or maybe we could reach out to your family and discuss how they could help support you. So we're going to look at all those resources that we can continue to support you in your independent living apartment and what seems appropriate for you individually. So it's very individualized because nobody's the same every single. But we have lists of outside resources, private duty. We have experience with the different companies, so we can always make those recommendations prior to then considering a transition.
All right, I'm going to stand up because I've got quite a few slides to present. And I'm short and I can't touch the floor and my legs go numb. So we're going to start with that.
You want this?
Sure. I was wondering who masterfully had control over the slides. All right, so Newfound. So kind of what to expect. Most things start with a health assessment. So when you've made the decision that maybe Newfound and moving over, either temporarily or permanently, is best for you, we're going to kind of talk about what kind of help and support you might need day to day. We're going to review the levels of care on the next slide, but we're going to look at sort of, do you need a little bit of help getting dressed, or can you do that independently? Do you need help with medications? Maybe we've already learned that because that's what you're getting through the home health program. Maybe you need a little bit more help with showering and things like that. And so we're going to have, it's called a health assessment, but I by no means whip out a stethoscope and start listening to various parts of you. It's really more of a conversation about, where are you currently at? What are the things that we can help you with and that you might want some additional help with? And then how can we manage that, and what level is going to best suit that? Regardless of the level of care that you qualify for, whether it's assisted living, enhanced support, or memory, we have nursing and nursing team members in the building 24/7. So there is always a nurse on each floor. There is always nursing assistants and medication assistants on that floor. You're always going to have activities and programs that you can attend. That's usually offered up to 7 days a week. And you're always going to still remain a part of this community. Whether your apartment is in independent living or whether you've made the transition to supportive living, we're still one community. It's not this big segregation or Great Wall of China that goes up that keeps everybody apart. You're still going to have your friends. You're still going to have the things you enjoy coming over to independent living for, and vice versa. And it's about meeting you where you're at and giving you that extra support while still allowing for you to be as involved in the same community you've always been a part of for as long as possible. So the levels of care. So we technically have 3 different levels of care spread across 4 floors. Third and fourth floor are true assisted living. So those are the apartments that have little kitchenettes inside of them. They have a refrigerator, a seating area, and a bedroom, and a bathroom. And they also have a locked door. So for residents to be safe on assisted living, they generally have to be safe behind a locked door, be able to utilize their pendant when they need help, and know that we're not just going to be coming into your apartment and checking on you. So if you need something outside of if we're coming in to give you medications, that you do need to utilize your pendant and you know to do so. Second floor is our enhanced support. It's where we can take care of the highest care needs, whether that's cognitively or physically. We can help people more extensively with getting dressed, taking showers, wound care, any kind of specialized care that somebody might have. We've had residents go out to the hospital and need an additional week of IV antibiotics, and there's no reason for you to stay in the hospital for the 1 week if you're otherwise stable. So we've accommodated doing that IV antibiotic here on our second floor. We've dealt with feeding tubes. There really isn't anything short of a ventilator that we wouldn't or couldn't do on the second floor of Newfound. So that's where our residents reside who have sort of the highest care needs, whether that's they need a lot of cognitive support, physical support, or a combination of both. And then we have memory support, and that's kind of as it sounds. That's typically where residents who are having more cognitive difficulties and are declining quicker cognitively versus physically might go to reside. And so we have specific programming on that floor that's geared towards memory, and for residents to engage in that way. But each of those 2 floors have a nurse and have additional LNA supports that are more than what assisted living has because the care needs are higher. So the things that are kind of included generally with assisted living is daily tidying of the home. The nursing team will usually help kind of make your bed if you need some assistance with that, things like that. And then weekly laundering and weekly housekeeping, which also includes a once-a-week change of beds and things like that. Any resident, regardless of level of care, is going to get 3 meals and an unlimited amount of snacks at all of the restaurant-style dining areas that we have. So much like Jackson's Landing here, it's open for a set time. You can come down. You might eat 1 meal or 2 meals here in IL. Over in supportive living, Rosemary's and the various dining areas are open much to the same hours, usually 7 in the morning until 5:45 at night is the last seating. And it's still restaurant style. You sit down, somebody brings you a menu, asks what you want, and makes it. And that's available during their times, and then there's additionally snacks and things that are kind of out in the meantime. We offer the care management services, so our team works really closely with Molly and Jen and their interns to help support all of the needs that you guys might have, whether that's coordination of care. If you go to the hospital and you're a resident of Newfound, Molly's still gonna follow you and get updates from the hospital and make sure we have everything we need and that we're ready for you when you're ready to come back. Social activities, there's always something going on endlessly over in supportive living, and anyone still also can engage in any activities over in independent living that they wish to as well. We can both take over medication administration and do all of your meds for you and keep track of them, including refills, knowing what time you need them, or we can also provide oversight if you still want to do some of your medications. Maybe you still want to maintain giving yourself insulin if you're a diabetic, but you want the rest of the meds to be done by us. Our team can help oversee you giving yourself your insulin and making sure that it's accurate and things are well. And it's really a lot of coordination of care. It's coordinating with your PCPs, making sure we have updated med lists, making sure they're aware when you go out to the hospital and anything that might change, helping to manage specialist appointments. As many of you probably have experienced, doctors' offices are not very good at talking to one another, and so they don't always have the most up-to-date information. And part of our job is to make sure that we're providing that and keeping it consistent and cohesive in one place. We can help with appointment reminders. We can help you set up follow-up appointments. And we work closely with Jess's team to make sure that everybody who needs transportation to their appointments for medical have that available, regardless of whether you need to go in a wheelchair or regardless of whether you can get into the passenger side of a car. We have licensed nursings 24/7 in the building. There's also always a nurse leadership on call. So that includes myself, Lauren, our 2 nurse leaders. One of us is always on call 24/7 and available if the nursing team has a question, if something unusual pops up, or if something happens. And then we can provide reminders for meals and any activities that you enjoy. Enhanced support includes all the same things as assisted living. The housekeeping is a little bit more frequent on enhanced support since the care needs are higher. There's still meals. Each of the second and first floor are broken up into A side and B side. And so on each side, there's a dining area, a kitchen, and a place, sort of a common area surrounded by 12 apartments. And so that's considered one household, and then households, they can go between any of the floors. There's no restriction to movement. It's just having a nice place to have everyone be able to dine. We can help more extensively with dressing, grooming, bathing needs. If you need 2 people to complete a shower, we have that available on the second floor. And same thing with bathroom assistance, no matter what that looks like. We can also do lifts on first and second floor. So if your mobility has gotten to the point where you can't stand very well anymore, or you can't bear weight on your legs, we can use a variety of different lifts to help ensure that those movements and those transfers are safe, both to you and to the team caring for you. And then memory support. As we've said, there's a lot of specialized programming on memory support. Any resident is still able to attend any specialized programming, but we also take into account that those with cognitive challenges might need a little bit something different. It might need to be an activity set up in a different way or focusing on something specific. And so we have the programming available to sort of target and further engage those folks who might have a harder time attending bingo or the standard activities that exist over in supportive living. Everyone's care plan is individualized, so it's based on your needs. One person's care plan is not going to look like another person's care plan. There's going to be different interventions, different ways in which we're helping you, and our goal is to really meet everybody where they're at and support you the very best that we can. And then we do activities and appointment management. So regardless of whether you're on first, second, third, or fourth floor, we can make appointments for you. We can help make sure that you have the follow-up appointments that you need. We can help with medication refills so that you don't run out. I'm sure, as we all know, it's quite painful sometimes to get a hold of your primary or a specialist to get a refill or a renewal of a medication. And so we kind of take that over for you. We sort of become the bug in somebody's ear that this is what we need, this is where it needs to go, and this is what we have left. And then care conferences. Everybody gets a care conference 2 weeks after moving in, whether you're moving in permanently or whether you're just coming over for a respite stay. After that, we do them every 6 months. So every 6 months, you'll get an invitation to attend a care conference that you can invite your family to, as many as you would like, where we kind of talk about the amount of assistance we're currently providing to you. What are the things that nursing is helping with? What are the things that you enjoy attending as far as activities? It's really meant to not just focus on the clinical picture of somebody, like your lab results or your latest echocardiogram. It's really meant to look at the person as a whole. How much assistance are we providing? How engaged are you with the community? Is there something we can be doing different or better? And what changes have we or haven't we seen in the last 6 months? We can also do a care conference upon a family or resident request. So if you feel like you just need to meet with the team again and there's a couple things that have come up that you want to review, we can have another care conference in between that period. And then with any significant change. So if you're somebody who is residing on assisted living, maybe still pretty independent, we do your meds for you, and that's about it, and something happens and you go out to the hospital and you come back and you need a lot more assistance with something, we consider that a significant change. It can be both a decline in functional status over a short period of time. Less common, but certainly possible, is that you've gotten dramatically better and are, maybe ready to move up to assisted living from the first or second floor. We've only seen that a couple of times, but by no means impossible. And it's really just meant for all of us to get together and talk about you as a person and how we can best support you, and whether all of your needs you feel like are being met. And then for those of you that attended my Falls presentation back in July, I do not have time to go over the entirety of it here, but I did want to take an opportunity to kind of review what we have in place for falls prevention and intervention in Newfound Lodge. So I really kind of focused on recapping that presentation into some bullet points of what we do. So as we've talked about, everything is a person-centered care approach. So what works for you may not work for your spouse and vice versa. So our job as a clinical team and as an interdisciplinary team is to really get together and talk about what are your needs, how can we best meet them, and what are things that are going to work for you and that you are in agreement with. On second and first floor, we do frequent rounding. We often refer to it as environmental rounds or purposeful rounding, but the goal is that we're checking in on residents more frequently. So that could be every half hour, that could be every hour, it could be every 15 minutes if you've just had a fall. It really kind of depends, but the idea is that we're up and looking at residents, laying eyes on them, even if you're just sitting in the living room watching some TV or you're napping in your room. Our goal is to go in, quickly lay eyes on you, make sure that you're safe, that you're still where we put you or where you put yourself, and that you're doing well and that there isn't anything you need. We use that as a time to declutter the environment. So you can imagine if you've got 24 residents who all walk with walkers, sometimes they can kind of end up everywhere on top of all the other equipment that we have. So we make it a point to make sure that there's clear pathways, that there's plenty of space for residents to come and go and for team members to come and go. We can do rehab screening. Sometimes that's based on, we've kind of gotten to know you over the last couple months. You seem to be limping a little bit more on your left leg. And we can have a conversation and talk about maybe a PT eval would be really helpful. Meeting with a physical therapist and seeing if there's something else that we can do, or do we need to have a follow-up with your PCP? Those are all kind of things we can do. We can help you pick the right footwear for engaging in the community. Certainly, we work in your home, you don't live where we work, so we certainly encourage everybody to wear the footwear that's most comfortable for them. If you really want to walk around barefoot, you're certainly more than welcome to. It just might not give you the same grip as that good pair of sneakers. And so we talk about that. Doesn't mean I'm going to make you put sneakers on every day, but we're going to talk about what it looks like or what the risk might be with not doing that if you're, outside of your apartment. And then continuing and ongoing assessments. We do a lot of education with residents and family members on how to stay safe, especially as people get older. What times of day are more common for falls? What are some factors that tend to lead to more falls? Sometimes that can be, many of us have to get up in the middle of the night to go to the bathroom. We may not wake up completely. I certainly ping pong my way down my hallway to my bathroom in the middle of the night, and I'm not considered a high fall risk by all standards, right? So it happens. There's certain times of day that you're more prone to something like that, and we can talk about how we can minimize that risk for everybody. We can use things like floor mats and hospital beds, which help create less distance between the mattress and the floor, depending on each resident's needs. And then we have different equipment like gait belts that can help us move you and help ensure that we have a good grip on you or steady you if you're having some difficulty with your balance. But first and foremost, everything is around getting to know you as a person, what your routines and habits are, what's important to you. And then our job is to tailor our interventions for things that align with that. And you can certainly take our advice or not take our advice. And our job is just to make sure that everyone understands the risks. So if you absolutely do not want to wear sneakers, I'm not going to make you wear sneakers. We're just going to have a quick conversation that might lead to a higher risk of a fall because there isn't the grip and there isn't, as much support as it might be if you had a sneaker on. But that doesn't mean I'm going to make you do anything. That's not my job. My job is, and our job collectively as an interdisciplinary team, is to help you live the best and fullest life that you can, regardless of your age, regardless of whether you're in independent living or supportive living. And as a quick reminder, if you'd like to see Newfound, if you have not wandered over there or you'd like a more in-depth tour, Molly's next tour is going to be Friday, October 18th at 11 a.m. She meets residents in Jackson's Landing, and they kind of go from there. So we'll have these slides posted, and I'm sure Molly will send out an additional reminder. But if you're interested or want to get a better layout of what Newfound looks like, feel free to jump on that. Questions? Hi, George.
They're bringing.
Yeah,
They're bringing it.
The mic is coming.
It's coming.
Thanks. This is not anything negative because when Kathy was over there, I was 95% in favor of everything she got. I have 2 questions. One thing deals with falls, and I sort of blame myself. When Kathy fell and broke her femur, I thought, gee, why didn't I ask you guys to put a bracelet on her so she wouldn't go out on the elevator and go out on her own? Because I always said, Kathy, don't go out without some assistance. Well, she didn't listen. But is that possible? I mean, I didn't really know I had the privilege to ask for that bracelet. Could I have done that? You know what I'm talking about?
Wander Guard.
Pardon?
You're talking about the Wander Guard
Yeah.
that we have in place.
So
yeah.
she couldn't get on the elevator and just go outside, because she had various falls out there. She should have been prevented from going out. But
Yeah. So, if it was something that you want, we're always willing to have a conversation and provide education around it. The Wander Guard system is so that we don't have a locked unit. So we don't have a locked memory care unit. We evaluate each individual to see what their elopement risk is. So the purpose of a Wander Guard is not really to keep someone from going on a walk. The purpose of a Wander Guard is if we have someone saying, I was supposed to go pick my kids up from the bus at 3:00 today. I'm walking out that front door and getting to the bus. It's to stop them from leaving the community. So it's not really used as a fall prevention measure. It's used as a measure to keep people within the community and to keep them safe. Does
but
that make sense?
had I asked for that, would you have given her that prevention? I blame myself because I thought I should have thought of that, but I didn't. So she goes out and falls.
Yeah. I don't want to talk about any specific person because I don't want to.
No, I'm not asking. I'm just asking if somebody asks you.
We do assess.
We do assess each person. Whether someone asks for it or not, we assess each person to see if they qualify for a Wander Guard. And the purpose of that is, once again, not to keep them from wandering within the community. There are plenty of people that go for walks. Maybe they get lost. They're getting their way back to their apartment. This is for people who are purposely trying to leave the community for an unknown.
Okay.
Yeah.
The other thing I had a question about what we have 4 married units in assisted care. Is that
There are
right?
4 two-bedroom
Yeah.
apartments.
Why is it that you give those units to people outside, you know, that they didn't come through? Because I would think you would give preference to the other side.
So we give preference to life care contract residents, so all of you. And at different times when those apartments have become open and we've gone to people to say, hey, what do you think about this? We were told over and over again, no, thank you. So as those apartments come up and we know that there are couples that would consider a move together to Newfound, then we will have those conversations
So
again.
we would have preference.
Yes.
Okay.
In
Yes.
any part of the building, you have preference.
Yep.
No, I got it. Oh, which is also a reason to kind of have conversations with me and Jen early on. You know, if you are thinking that you might be interested in a 2-bedroom unit for you and your spouse, if one were to become available, maybe not right now, but when is, that's something to let us know. Because we certainly will reach out to you, but we don't know what's going on behind closed doors. Unless you want us to, you're welcome to tell us. But you know, you have your own privacy, and so one caregiver's life looks very different than another's, and we can't assume that one person is ready and one is not just on what we see from the outside in. So, if you are considering a move, you can tell us that. That doesn't mean you need to move tomorrow, but then if you'd like to be considered for an open unit when it comes available, we know to reach out to you and let you know.
This is just a happy thought. One of my favorite parts each week is the sing-along at 1:15 in Mariana's Lounge. And 2 reasons. One, everyone in the room claims they have a terrible singing voice, including me. Almost like a competition. And yet collectively it sounds wonderful. Even more important, I just love the fact that it's one of the few places where there's a wonderful mix of people from supportive living and independent living. And people coming in with walkers and wheelchairs, some people who are neighbors over in independent living. So it's, yes, sometimes people from supportive living come here in this large room, but it's not the same. And I value that. Thank you for making it happen. It's probably one of my favorite hours of the week.
Thank you.
You mentioned a number of reasons someone might want to go to Newfound. You also said that going to Newfound requires an MD order. Could you kind of sort out what requires an MD order versus does not require an MD order?
Yeah, over in Newfound.
Right.
So, yeah, so we have a state license, so we're regulated much like other healthcare places. So, to come to Newfound, we have a standard admission order sheet that if you are looking at moving or need to come over, we would send to your provider for their signature, essentially saying that they're on board with you coming, that they're going to send us the most recent notes, that they're going to send us a medication list. All those things we need in order to be able to give medications, take care of you, in addition to once you come over your consent. So it is still a medical building that's kind of run off of orders. So I can't just say, I think you need PT, let's walk you over to the rehab gym. I still need to get an order from your primary care saying why we're ordering or why we're getting PT. It's yeah, similar to if you're in independent living, right? You can't just go walk over to the PT gym and say, I need you to do XYZ for my knee. You would get an order from your provider that would go to the Wentworth Douglas and they would schedule your physical therapy. It's very similar in Newfound when it comes to assisting you with getting dressed and going to the bathroom or taking a shower. Those are not things that we base off of a physician order. That's based on clinical knowledge, having an understanding of you as a person and kind of what your needs are. But any kind of medication, even if it's an over-the-counter medication, we need an order for it signed by a physician. So if you're someone who takes 13 different multivitamins, I highly recommend you make sure your primary care is aware of what you're taking and what concentration you're taking. because we need that information in order to give you the same multivitamins in Newfound. So those things are still driven by orders. As far as personal care, that is decided on how functional you are, how you move, whether you use a walker or not, and kind of working with you to determine, is you someone that you mainly get dressed by yourself, but you have a really hard time putting on those compression stockings, which is a minor workout every morning for most people. That's very different than needing help completely getting dressed from head to toe because you suffer from a physical impairment that is limiting and is progressively going to get worse over time. Any kind of lab work, imaging, all those things would require orders from a physician. It can be from a specialist, if
Nurse
it's a
practitioner or
cardiologist,
physician assistant.
nurse
too.
practitioners.
Just, I don't know if that's
Not
the
just an MD,
clarification too.
yeah.
It doesn't have to be just a physician. It can be, if your
Right, a
primary care is a
provider.
nurse practitioner or a PA.
Yeah, a provider. Caitlin often writes admission orders for people if you're not needing to go out for an evaluation, but you're having trouble with an old back problem that seems to be flaring up for a couple weeks. Caitlin can work with you and get those admission orders signed and over to us, and then we can reach out to your primary care for medication lists and things like that.
I think
Hi.
I've used every service, including one you haven't mentioned yet. That's the quilting ceremony and the
Mhm.
hospice.
Mhm.
But there's one need that I had when I come back after my open heart surgery. So after Friday, it was a Saturday, I ran out of the packing material that stuff into the wound where they take out an artery. And I thought, wellness centers, what do I do? So I went over to the nursing center, and the person on duty said, I can't help you because I don't have I'm not a resident in assisted living. That's part of a licensing thing. And I think that may have been addressed with first aid kit availability somewhere. I'm not sure. But I resorted to claiming, that the HIPAA laws, you really should give me a wound dressing or something. But
Yeah.
that was one thing that needed. And then the other question I have is, when Bonnie was moved upstairs, and there was a need for that, I was not available. I was on a fishing trip or something. And they put her in a hospital bed. And the bed that she had, which wasn't a great value, but I don't know what happened to it. What is the procedure for taking care of those things?
Yeah, so I'll tackle that one at a time. I think the bed one is the fastest one. So if we determine that, based on a resident's mobility or what their care needs are, that a hospital bed would be more beneficial, we do keep a stock of hospital beds and we can swap out the bed. We don't throw away the old bed. We'll reach out to the family and ask, kind of what do you want to do with it? Would you like us to return it to you? In the meantime, it gets taken apart and put, down back of hallway or in storage so that it's not in the way and not eating up space in a room. But we will give it back to you if you want it back. If you say, nope, I don't want it back, it can go to the dump, we can help handle that. And so it really just kind of depends on what you want. But we don't inherently throw anything away if we need to make that transition.
One other issue, and that had to do with laundry. I spent a couple hours going through the revised handbook last night. And there's a statement that says that we are not responsible for lost or damaged laundry. Now, Bonnie had some quite valuable sweaters that went to the laundry and they got washed in the regular cycle, and they were wool, and they wouldn't fit any of your babies that are coming along. It was so small. So I didn't have any redress for that, and neither did she, and we could afford to buy a new one. But I think it was early on, so the staff might not have known that wool you don't throw in the laundry or something. I think they're probably better trained now, as we're a more mature facility.
We're still not taking responsibility for that for that laundering though. So if things need to be washed a certain way, you either need to make sure it stays out of the laundry because we don't know when people are going to go in to do the laundry. And that's the deal, is that they all get washed and then they all get dried in a dryer. There's no air drying.
Right.
Unless you somehow pick it out and take it home on your own.
Or unless you're doing your own laundry. There are washers and dryers on each floor for residents to do their own laundry. And so we have plenty of residents that maintain doing their own laundry, even if they move into assisted living, or their families a lot of times will do it or make sure to take those pieces that need a more delicate wash.
We also have
to
a dry
cleaners.
clean pickup if someone wanted something dry clean. But once again, that's not the staff here going through a dirty laundry bin, picking out what we think is dry clean and what is machine washable. That, you know, that responsibility lies with a resident or a family.
And as far as living in independent living and receiving care in Newfound, you're correct. You can't come over to Newfound to receive nursing services if you're not a resident of Newfound, whether that's as a respite stay or as a permanent stay. And that does have to do with licensing. The way that we staff each of the floors in Newfound is specific to the number of residents that reside on each floor and is based on a minimum staffing requirement that we have to maintain. So we don't have the ability to then take kind of walk-ins like in urgent care of residents that aren't ours, that we don't know what they take for medications, we don't know their medical history. It wouldn't be safe for us to care for anybody without knowing those things about them. So we do only care for our residents. If there's a need in IL for additional support, that's kind of when we tell you to reach out to Jen or Caitlin. Certainly go to walk-in hours. If it's after hours or on the weekends and there's a concern, our recommendation is always, go to urgent care or the ED if there's a concern. But we can't take care per our license and just in general for what's ethical and safe in patient practice. We can't take care of independent living residents in supportive living that aren't our residents to care for and that we don't know anything about, because it wouldn't be fair to you, and it's not diligent practice for us to give recommendations or make recommendations to somebody when we don't understand their past medical history, their medications, and the things that other factors that could be involved than what is specifically in front of us.
It sounds like, Sam, maybe you have to assume responsibility when you start to give out bandages and things like that. So nursing staff has to do that, and that's not what the license is set up for. And that's, I'm assuming, what your individual licenses are not
Correct.
set up for. So.
Yep. Yeah, if we give any kind of medical advice or medical care, we are assuming responsibility for everything that we're saying and doing. So legally and per our licenses, we need to make sure that we have a good understanding of residents, and that we're not giving false advice. It's exactly why I don't like going out and saying that I'm a nurse to anybody outside of the world, because you can imagine the amount of people at the bar that find out you're a nurse and are like, can you take a look at this rash? No, thank you. Not what I'm here for. So, yeah.
So we do now have first aid kits in every trash room, and security has first aid supplies on them too. So, and they're all trained in basic first aid. So if it's not a major, they're going to help you as much as they can, regardless, get the care that you need. So security is a good resource too.
Pressure pendant.
Pressure pendant.
The enhanced support, second floor. It's always been a curiosity to me. I guess the question really is, what can't you do, and what would necessitate moving a resident off the second floor to some other facility because what their care need is you can't meet on the second floor?
Yeah. So with the second floor being our highest level of care, there are some still, as you're mentioning, some exceptions. We would not manage a ventilator in-house. So if somebody needed a machine to continuously breathe through, that's not something, even if it's meant to be long-term, that's not something that we would do under our license. We can't support one-on-one care in which a resident would need one person to be with them and take care of them at all times, and not have any other responsibilities. That's not a level of care we can meet. That can happen, most often we see it a result of, progressed cognition changes that are really severe, though not necessarily typical. We've seen it when there are other psychiatric diagnoses involved and somebody's medications aren't managed quite as well or they're not as effective now, and we might need to send them out to get that corrected before returning to us. And we would not be able to do in-house dialysis. That's a kind of above our licensure, as well as kind of, it's a very specialized treatment that someone would still have to go out for. Outside of those few things, go for it.
We've also come across a few times, we mentioned IV antibiotics. If you're on an IV antibiotic and one antibiotic, you're on it for a week, you want to come back here, we can continue to give you that antibiotic. But a lot of IV medications are compound medications that have to be mixed that day of. We do not have an on-site pharmacy, and so that's also a situation where we've come into, you need a more specialized community where they have an on-site pharmacy, compounding pharmacy.
And typically at that point, you're really just going to stay in the hospital for that. You know, we can do IV medications that come in a bag that don't require any mixing. The other component we take into effect is how often that IV medication needs to be given. If it's something that needs to be given every 3 hours or every 2 hours, that's very different. We also can't do what's considered a push medication. So if any of you have been in the hospital and had to receive a medication that they attach the syringe to your IV and kind of push it in one fell swoop, that's not something that we can do in Newfound either. That would require remaining in the hospital.
With respect to hospice care, the care of people who are on serious pain medication, morphine, are you able to take care of that type of need?
Yes. Yep, we have, hospice works by contracting with a hospice agency, just like it would if you were at home. So residents are free to use whichever hospice agency they would like. And then, yes, we can give all of the end-of-life medications like morphine and Ativan, Haldol. There's a variety of different meds that can be given. We wouldn't necessarily be giving them IV. Typically, those end-of-life meds are oral and they're liquid in form. And we can give those as frequently as every hour. You know, we work really closely with the hospice agencies to make sure we have the meds that we need well in advance of actually necessarily needing them, so that we're not scrambling at the end of the day. But one of the benefits of having nursing and a nurse in the building 24/7 is the ability to manage residents at end of life and ensure comfort throughout until the time of passing.
I was wondering, there's a lot of people here that really don't have family, people that had no children. I only have one kid, and he's in Japan. So he wouldn't be a resource to you if you needed him to come to your sessions. What do you do in a case like that?
So he's still a person and he's still on the earth, so we would reach out to him via email, that sort of thing. But if you're talking about, what are you talking about you would need him in person for?
Well, I mean, I have no children really here. And so if you wanted to discuss with him, let's say I couldn't make any decision because
Sure.
So where do you go?
We would go, so it's whoever you've listed on your advance directive to make your medical decisions for you. We'd go to that person. So it doesn't have to be a blood relative. It can be a friend, kind of anybody that you're social with, that you trust would make your decisions for you. But regardless of where they are, we'll reach out to them to have a conversation about what's happening.
It all goes back to what I said when I first came in.
Yes.
Okay.
And making sure those documents are always up to date. And then Jan has a question over there. Or something. I won't assume it's a question.
In some ways, it's a clarification of things I don't quite understand. The double room that you were talking about, both people could be there.
2-bedroom apartment, yes.
That's not used for temporary respite, I would presume. You would have to
So this is
move-
Riverwoods. I would never say never, but that's not the plan that those would be used.
You would be giving up your apartment to move over.
Yes, if you're not going over for respite and it's a permanent move to Newfound, then yes, it's the transition from your independent living apartment to the Newfound space, whether it's an apartment on the 3rd and 4th floors or a suite on the 1st or 2nd floors.
Okay. And the other thing is, we're talking about the guard. Is the guard available on all 4 floors, or is it only available on one? I thought it was only available on one, but
Nope, it's available throughout the entire building. So
Okay.
regardless of whether you're maybe in a dual occupancy room and it's your spouse that needs the Wander Guard, it can be there and it will keep them from being able to go down any stairwells, the elevator, or exit the building. So you can have it at any level of care within the Newfound building, and it'll work on all of the doors. So we have residents across all floors that utilize the Wander Guard for various reasons.
So you can stay on that one floor that you're on,
Yeah.
and then the other pieces are locked.
Yep, and like Molly said, it prevents us from having the need to do a complete locked unit, which would then force us to have to put residents who were in elopement risk or in need of a Wander Guard only on one specific unit, regardless of overall functional status. By using the Wander Guard system, it allows us to maintain residents at whatever level of care is most appropriate and what's best for their well-being, while also ensuring their safety. Any other questions?
Hold on. Oh, Janet's behind you.
Just to follow up for the Wander Guard, I'm still a little bit confused. If I were outside walking around and I meet up with somebody who I know is over in memory care or somewhere on the 2nd floor, and they seem confused, is that, what am I supposed, I'm assuming that you know where they are?
Yeah, I would say if you see something, say something. If you see someone who's confused, could offer help. Not every person on memory support has a Wander Guard. We have residents that are on memory support that do a loop around this building every day. It doesn't mean that they're lost. That being said, day is a little different. So if you do see someone and they are confused or they appear confused, say your best bet is to first ask them, do you need some help or do you know where you're going? And if they seem confused beyond that, that they don't know where they're going or why they're outside, I would call for help, either on your pendant or theirs. But yeah, not every person has a Wander Guard. It's an individual assessment. There are plenty of people that go for meaningful, purposeful walks outside and within the building. Like I said, you know, the goal is really to keep people from leaving the community when they have a purpose. So there's, you know, if they think that they really got to meet that school bus at 3 p.m. every day, we want to make sure they're not walking down to 108 and trying to meet the school bus. If they're getting outside, I want to get some fresh air. Even if they have a Wander Guard and it's, you know, locking the door, we're going to open the door for them. We're going to sit outside with them. Probably just radio, hey, this person's sitting outside. Keep an eye on them. Make sure they come back inside. It's really not to restrain anyone. It's to keep people safe within our community.
Thank you. I was just wondering what my role was. If someone seems confused and, yeah. Who would be the best person to contact then during the workday?
Yeah, I think it's,
Press their pendant?
or yours,
Or yours.
Really?
if you're gonna stay with them, yeah.
If outside. I would also too go to the Newfound front desk to let them know if you're outside the building walking around. The pendant doesn't work, you could go to the front desk as well and just say, hey, I saw so-and-so outside.
Oh,
Or if you
okay.
have your cell phone, you could call the front desk and let them know,
Yep.
you know, this is where I am. I just passed so-and-so. They seem maybe.
Well, both situations were actually wandering in near my apartment, which was not where they lived, or they were just looking for something. So I knew they were confused. They were both inside situations,
Oh, okay.
in independent living, and just seeming confused as to where they were.
Yeah, and really the goal of the Wander Guard is to prevent elopement, which is different than wandering. Wandering can be therapeutic for a lot of people. Some people just need to stay moving, and so they might wander throughout the various floors of Newfound. They might wander back over to independent living if that's where they used to live, and then make their way back. Elopement is really, which is what the Wander Guard is more addressing, is when folks don't understand or don't have the ability to understand the dangers or can't find their way back or know how to ask for appropriate help. That's really when it kind of crosses the line into something that we need to be more concerned about. And because then the concern at that point is that if that resident walks through the front door of the community, are they going to know how, do they know how to get back? Do they understand the dangers of the weather and of traffic nearby? And if somebody stopped them and asked them, are you trying to figure out how to go home? Can they actually appropriately respond to that question in a way that someone could get them safely back? Those are really kind of the things that we're more deeply addressing when we start to talk to families or residents about potential need for a Wander Guard.
Okay, thank you very much.
Yeah.
I think we should wrap up with respect to everybody's time. I don't want to keep everybody too late.
Yes, so in that regard, could you put the slide back up from the beginning that shows the remaining sessions that you're going to have?
Yes, I can.
Thank you all for coming.
Thank you. So there is a slight difference with the layout. So just to keep in mind, next week's presentation is the finance portion. So finance will be here to talk about the financial differences. And then we'll loop back the following week with meet the team and what each of our jobs kind of entail and how we support Newfound.
And if you just leave your survey right on the table, I can grab it or give it to Jess on the way out. Fabulous. Thank you.